I've been saying this all along, but finally the world agrees. The undetectable era of plastic surgery has finally come to the mainstream. I actually was just talking to the Daily Mail about this very thing today. So, the undetectable era, what that means is less is more. Patients are opting for more natural results, whether it's fillers, Botox, surgery. In the past, we've seen it. We've seen the bigger is better. We've seen it with breast augmentations, very large breast implants, over exaggerated BBLs, Brazilian butt lifts, overdone fillers, huge lips, the past Kylie Jenner lips, fox eyes. All of these things are very unnatural and frankly don't age well. Now we're seeing a shift where natural is better, undetectable. That's the whole thing. When I have patients come into my office, I tell every single one of them the goal is to not look like you've had something done. All of your results should be natural, like you were born that way. That includes fillers, Botox, and really any procedure that you have done. These procedures are for you to feel your best, to age gracefully, but not for everyone to notice from across the room. And this is why that article was published, because this is Christina Aguilera at age 43, and she looks amazing. Even compared to her pictures from last year, she has dissolved some of her lip filler. She certainly lost some weight, and her look is just very natural. She looks like she's aged gracefully. She does not look like she has fillers and Botox, although she's gotten that done over the years, as well as, I'm sure, skincare, lasers, chemical peels to maintain good skin health. So she looks amazing, and this is how all plastic surgery should look.
I'm just saying this because I know y'all were thinking it, but there is a new surgeon in Hollywood. I don't know when he arrived, but it wasn't that long ago because the girlies are looking snatched. Google it. Google it. I am telling you, I know you've noticed. In the last year, people who 2-3 years ago were looking a little rough or would naturally just age are now snatched. But here's the thing, it looks similar. It doesn't look like filler. It doesn't look like Botox. It looks like a facelift. A very well done facelift. I love this for them. But I'm just saying, there's a new surgeon in town. I don't know any other information aside from that, but he has opened up shop.
Is it just me, or does it appear as though Lindsay Lohan is aging backwards? She seems to look very good these days. Let's take a look and see why this may be the case. Looking at her across the years, you'll notice she maintains her youthful appearance up until her mid-20s. But 25 onwards, she begins to show signs of aging. This is most prominent in her under eye area, with some laxity and fat pad herniation here. As she enters her 30s, she seems to lose the sharpness of her jaw and appears to have more fullness in her face. And then when she heads to 40, there is a dramatic change which you can see here. Looking at her before and afters, you can see a significant change. So the thing that strikes me straight away is she looks far more snatched now. So looking at the jawline, looking at the nasolabial area, so this area has been taut, it's more tighter, the jawline is much more sharper. She has less volume in the mid-face, because prior there was a lot of volume in this area and it seems as though it was sagging downwards, but it's just completely rejuvenated. How can this happen? So this is definitely a combination of surgical and non-surgical procedures, but I'm tempted to say more surgical. This definitely does appear to be some sort of surgical lift. Yes, weight loss can contribute towards this, but when you undergo weight loss, you'll have laxity of the tissue. For your facial tissues to be this taut and tight, this is definitely some sort of surgical lift based on speculation and my opinion. But what do you think? What do you make of her recent facial appearance and the changes that she has undergone?
When I say Donatella Versace, Versace. When I say Donatella Versace, I think that's how you properly pronounce it, right? Who cares? When I say Donatella Versace, what face do you picture? What comes to mind first? Is it This? It's probably not this. This is a new face. Oh my God. The internet is abuzz over this. Donatella Versace showed off her new face at the premiere of The Devil Wears Prada musical by Sir Elton John in London yesterday. And people want to know, what did she do? What kind of procedures? Is it surgery and fillers? Is it just filler? Is it dissolving filler? What's going on here? Well, I have the answer. It's Madonna level photoshopping. Yeah, that's not what she looks like in real life. This is what she looks like in real life. And she might have actually had some new work done because this does look different than she did a year or two ago. This is just a few months ago, but this is real. This is not real. That's beyond edited. That is a whole other person. Yeah. Isn't the point of photo editing to appear natural? I mean, this looks natural, but it doesn't look like her. And you know what? She's 69 years old, okay? You look good for 69, I would say. You do you, Donatella. If you want to get more work done, great. If you want to do more editing, great. Madonna edits her photos this much, and I still love her. But this is not just exclusive to celebrities. The face tunification of the world is real and heavily commonplace amongst young people. I'm going to go ahead and just blame Kylie Jenner. Kylie Jenner is to blame for these unrealistic expectations, not just of beauty and changing your face, but also altering photos. Don't believe me? Ask a young woman under the age of 25 or even under the age of 30. I would argue the majority of them Photoshop or Facetune or alter their photos. And that's sad, I think. What do you think about that and this? I mean that. Let me know in the comment section.
What's behind Lindsay Lohan's recent glow up? There's been a lot of recent talk about Lindsay Lohan's transformation. People are saying that she looks a lot younger, she looks a lot healthier, she looks more attractive. And is that due to plastic surgery or is she just healthier? I think the answer may be a little bit of both. I think if we're looking at her face, she's now, I think, in her late 30s. Some of the changes I see in her upper face, on her eyelids, does look a little bit more open and rested. So I do think there's a possibility of an upper eyelid or blepharoplasty surgery to open her eyes up a little bit. I was looking to see if she may have done something like a ponytail lift, which is a sort of a facelift that younger patients do, because it doesn't involve as much as the neck as it does involving lifting the mid-face and the lateral brow. And I do see some changes in that brow, but I don't see a change in her eyelid shape. So if it was a very conservative sort of mid-face or a little lift out laterally, I do think she's taking better care of herself. She's probably doing a lot of skin treatments, microneedling, maybe radial frequency, fillers. I do think that she has a little more fullness in her upper face and it's blended very well into more of a heart-shaped face. Probably a little bit of lip filler. And then of course the Botox or subtle treatments to help reverse some of the signs of aging. I think there is some changes in her nasal contour, but I don't know if that could be due to just filtering some of the photos or contouring of the nose with makeup, but it does look a little bit more defined. And then of course her teeth. We noticed that she's showing off a nice pair of new teeth, which really brightens up her smile and also makes her look a lot younger. And one last thing I do notice are very subtle things, like she may have had an eyebrow transplant or some microblading of her eyebrows because they are fuller and more contoured. And then lastly, I think she's taking better care of herself. She's healthier, and whenever you're healthier on the inside, it's also going to show up as a healthy glow on the outside.
Christina Aguilera is looking very different these days. Let's take a closer look. Her facial transformation is a good example of the effects of aging, the impact it has in terms of volume losses. Now, when she was younger, what I noticed is good volume in her mid-face with nice cheek projection. As we age, all the layers of the face undergo atrophy, displacement, weakening, and descent. Now I want you to look at her mid-face because as she reaches her 30s, she starts to form nasolabial folds. This is when the fat pads descend in the cheeks, causing a fold to appear from the nose to the mouth. Now as she continues into her 30s, I don't notice significant changes until she reaches 35. Now here I'm noticing a lot more volume in her face, and her face shape is not as slender as it was before. This can be due to changes in weight, but also non-surgical procedures such as dermal filler that are used to target areas of volume loss. She maintains this facial appearance into her late 30s, but then when she reaches her early 40s and over the last couple of years, there's a dramatic change in her facial appearance, especially here where she seems to age backwards. Looking at her before and afters, you can see quite a significant difference. The thing that I notice is changes in volume. So obviously prior there was a lot more volume in the mid-face, and now she's far more slender. Also the contour of the jaw is far more sharper. So this can be attributed to changes in weight, but I suspect a combination of surgical and non-surgical procedures, most likely some sort of surgical lift, because obviously when you are undergoing weight loss, you can experience some laxity of the tissue, especially when you're in your 40s. But for her to maintain this facial appearance at this stage in her life, it is most likely a combination of surgical and non-surgical procedures. But what do you think? Let me know your thoughts in the comments below.